let's go ahead and get started. Welcome. Thank you for joining us today. Before we begin, we want to wish everyone good health and hope you and your families are staying safe during this time. In this second webinar, this is in our 5-part webinar series. We have one planned every Tuesday this month at the same time. You can register for those using this link on this next slide, or we'll show this later on as well, and we can email this out to you. In this webinar, we're going to discuss real-world testing specified in the final rule. In the next 2 webinars, we're going to deep dive into the test criteria, and the last webinar, we're going to wrap it up with the conditions of certification and surveillance. We'll post these slides and the recordings to our resources page later this week. I'm your host, Melissa Martin, and I have with me today John Belukovich, our Interoperability Program Director. He's responsible for building out our Healthcare Interoperability Hub. This was a deliverable by an ONC grant. He's been involved in healthcare in various roles across EHRs and consulting for the past 25 years, so he brings a lot of expertise into our interoperability program. Alongside him, we have our Surveillance Program Manager, Karen Stewart. She's going to answer your questions live during this event. We're going to do a Q&A at the very end as well. So some of those submitted questions we'll address at the very end, and she'll be able to answer those live during this recording. So any questions that aren't answered in the Q&A or during the webinar, we're going to answer via email. So please keep those questions coming. We'll also send out a link to the recording again with the slides. So if you missed something, don't worry, we will send it out to you. With that being said, we have a lot to discuss in real-world testing. So I'm going to go ahead and hand it off to you, John, to talk about the agenda.
Great. Thank you, Melissa, and welcome everybody to this Drummond webinar. So for today, addressing real-world testing, we're going to break it down in a number of different sections, largely as it's outlined in the final rule. So just a quick introduction at a high level to the rule itself and real-world testing. Then we'll get into a little bit about the certification criteria that encompasses a real-world testing. There's a settings of care guidelines, test data, and sort of the infrastructure within which you would do the testing. We'll outline some recommendations for that, as well as what we know about the format, which is emerging, and we'll discuss more in that section. The timelines that have come from the final rule, slight modification in terms of an understanding around that. We'll delve into that. And then also wrap it up with the idea in terms of Drummond as an ONC-ACB. All ONC-ACBs have to support their EHR customers in this endeavor, and we have a couple of ideas and on some different offerings that might make it easiest depending on your capacity for that. So again, appreciate everybody taking the time today. At a very high level, the theme throughout the Drummond webinars obviously is the focus on the Cures Act final rule itself. And we all know that from the NPRM through the final rule, the centric themes for the 21st Century Cures Act are the patient first, the ability for patients now to more than ever access, exchange their data, and use it for point of care throughout the continuum. The advancement of interoperability even further and further refinement in terms of the methodologies to do that, and then also provisions within the 21st Century Cures Act rule to prohibit information blocking. And again, all of these are addressed in varying detail, definitely more detail over the next 2 weeks with future Drummond webinars. As you all most likely know, the final rule was published in the Federal Register at the beginning of this month. Therefore, per the rules and regulations, the 60-day waiting period, it becomes effective on June 30th of this year. Within both touched upon in this webinar and in our first intro webinar and the subsequent ones that go into certification criteria are the varying compliance timeframes. And also a note here throughout this, the enforcement discretion, that the compliant dates remain as written in the final rule, but as health IT developers, you have some leeway due to COVID-19 to comply for some of these requirements. And we'll hit on those and how that applies to real-world testing in this presentation. Okay, so let's delve a little bit further into real-world testing as a whole. So for those of you that may have been attending some of ONC's webinars, you will recognize this slide here and realize that of the 7 conditions of certification, real-world testing is in fact one of them. So again, it has to do with the applying to health IT developers and maintenance of certification. When you think about real-world testing at a high level, again, it is for health IT developers. It is an extension of certification. It is aligned with the criteria identified in the new rule and regulation you see there, 405A. We will break that down. There is an annual requirement to submit both a plan and results. And the timeframes for that annual assessments are stretched out a bit, and we will address those specifically in this webinar as well. But the goal here in the final rule is that annually there's an updating process to both a plan and to results. And where the information is then posted to, obviously, is your chapel listings for potential customers to review. So let's look a little bit about the certification criteria that makes up the real-world testing. There are 6 major categories. There's about 24 total criteria, including subs to that, 2 of which are mutually exclusive. And what we'll do is we'll break those down just a little bit at a high level. You're probably familiar with these, but as written in the final rule, you'll note that the care coordination criteria, they do say it's very specific in terms of the B criteria. So listed out within that are the ones within the final rule, you'll notice, that apply to transitions of care criteria for real-world testing. If you're an EHR developer and you support one or more of these, then these are making their way into your plan and into your test results. The clinical quality measures, again, the record, the import and calculate, and then reports as well criteria are worked into the clinical quality measures. For those of you that offer portal-based technology, the view, download, and transmit, all those measures within E of 1 are part of real-world testing. Public health interfaces, as they go through and list those, you'll notice that the major public health criteria, again, just to enumerate there, are part of real-world testing. Application programming interfaces. So again, the G7, and they're specific here too in the final rule, 7 through 10, for instance. So we're used to application access for patient selection. You'll notice the data category request of 8 is replaced by standardized API for patient and population services. So the asterisk there signifies that the application access data category request criteria, you have 24 months from final rule publication date to migrate to supporting G of 10 within the API criteria. It's much like in care coordination at the top there, that the data category request is replaced by standard EHI export replaces data export within 36 months of the final rule. So the API update is within 2 years of the final rule. Important to note there that when we talk about criteria, that there are some are mutually exclusive, those are the 2. As you can expect, the transport methods and other protocols, criteria that have to do with the direct project, both the direct project itself, and then again, the edge protocols and input-output criteria. So again, those are with the new 17405A, you'll notice it's broken down into these 6 categories for real-world testing. So if you support, you have a chapel listing, and we'll break this down a little bit more for any of these criteria, one, all, or some, they're making your way into your real-world testing activities. So let's go forward a little bit and understand the settings of care. And it's pretty explicit in there that when they talk about settings of care, we look at a chapel listing, has to be accounted for in a test plan, has to be accounted for in a test result. So again, some of the highlights here, and it gets explicit within the rule that a test plan and a result, they have to account for each listing on a chapel. We know that. Further, the environment or that setting of care that the real-world testing is conducted in has to match the setting within which the product is marketed. So that's a blanket statement. And the rule goes further to spell out that health IT developers, you're not required necessarily test the certified health IT in each and every setting in which it's intended for use, but does require that the real-world testing plan has to match with each type of clinical setting within which the product is marketed. So it does allow for a single test plan to some degree to address multiple settings. So that's important to know. They do call out for those of you that are cloud solution providers. If you offer a cloud solution and it's in a single instance, it serves multiple clinical settings, it is spelled out that you're going to be required to test the same capability for those different types of settings. Now, we'll predicate something that early research and some conversations with some of you have led to discussions around clarification on POS, place of service codes. That is something that is we are working with ONC to clarify and be able to put that information forward as soon as we get it. But if you have users on versions that are out there, you have to account for it in a test plan and an associated result. And so what your advice here is start examining your products, your acute, your ambulatory, your portal, your interfaces, your APIs. Plan that, per product that could include associated portions. You may have to separate those out from the main EHR, but you want to look at your products as they're certified on the chapel and the ability to capture all of your products in a test plan and then capture the results for individual chapel listings is probably the best way to look at that. And again, we do expect a little bit of clarification from ONC on that. If you make, market, and sell a product comprehensively to more than one care setting, how your test plan may account for obtaining results that filter down to some of the subs that belong within that. So keep that in mind. Encourage clarity around the final rule. We do look at a white paper coming from Drummond to address this as well. So think about the test data and infrastructure next. Okay, it's very clear within the final rule that you cannot leverage any of those testing databases that you might have used for certification, those placebo type directories. I quoted the final rule here on purpose because I think it does bring some clarity in terms of what you want to start to be thinking about. They say mirror production environments. In my mind, in my experience, coming from an EHR background at one point, I would look at a test or a staging directory, which was different than the place in which we brought forth to certification that might have resulted in an on-prem or an environment that was only accessed by corporate. The wording is in the final rule that synthetic data is certainly acceptable, and I would think in this day and age preferred, and that what you may want to be thinking about is one of what the industry may refer to as your beta or early adopter customers to run some of those tests in, because there is language within the final rule that there is a bit of a burden that may be placed on either provider or acute-based organizations that you may be asking for some help from some resources on site or on-prem or a cloud-based environment to do some of your testing to in fact prove that it encompasses part of your real-world testing environment. I'm going to talk more about how you address that and how you prove that in a moment. But again, it's the test data and infrastructure is certainly important to note here. A little bit further about the infrastructure and things you want to be thinking about is that there is that protection of privacy, the theme throughout the 21st Century Cures rule and other rules and regulations. I'm going to recommend, if you don't have one, and most of you probably already do because you do access that customer directory for support tickets and the like and moving code in and updates. But you want to make sure, and it is loosely referenced in the final rule, that you have a business associate agreements handy. Part of your homework assignment, which you've probably already started to undertake, is start thinking about those customer directories now. Which are your customers that you know would be a good place to set up some of the testing that you have to do? Some all or portions of it, depends on your environment. Someone that is reliable, someone that has a system that doesn't go down often. Someone that has staff that you know you can rely on in terms of user access and testing, and even if it's a matter of what could be observing connectivity to another organization to prove that real-world testing is occurring. Think about those resources. Also, too, and I'm going to address it a little bit more detail on the next slide, is think about your trading partners. Real-world testing is twofold. Real-world testing does involve your organization and your software as an origination point. As we know, with any type of real-world testing and interfaces, there has to be a recipient or other side to this transaction. So you're going to have to be exchanging your real-world testing with another organization or organizations, plural. I do want to lend a note here that the Drummond organization is going to play a role with that. We have a few ideas I'm going to address a little bit more in this slide deck when it comes to the Drummond Services. But you, again, have to think about that choosing an environment to have your tests originate in, and then you have to have a trading partner. So start thinking about some of those trading partners now. And there is some guidance in the final rule around that. So they list off some of what would be the accepted real world trading partners where you could obtain some of the metrics that you need for real world testing. I'm going to put forth the Drummond Interoperability Hub. A little bit more in the next deck, but the idea here is a tool set we've developed with ONC. It is used and originated as part of a surveillance portion, but there is some opportunity there to leverage that for real world testing. And as a matter of fact, subsequent to this call at 3 o'clock Eastern, we're talking to ONC about just that topic and a few others. Other networks and trading partners that you'd be familiar with would be SureScripts, Care Equality, the Commonwealth Health Alliance, for instance, even some of the more public-facing tools such as the One-Click Scorecard, Inferno, and Direct Trust are queuing themselves up to be trading partners, and in some aspects have to go through real-world testing themselves. There's opportunities also to partnership with other developers. We have some ideas around that, some early discussions with a couple of customers. That may be a technology or a solution that may emerge as well. It is not purposely prescriptive in the final rule. These are just merely suggestions, and the final rule is, in this section on real-world testing, is meant to be open to allow flexibility, which I think, as we all know, having sat on both sides of the fences of certification, with the flexibility and comes ambiguity, and at some points maybe prescriptive, maybe a little bit more desirable. So we're going to have to do our best to go in between that and work out solutions that are best for our customers and yourselves. But again, there's some ideas in terms of some of the places that you will want to think about queuing up with and establishing some relationships, and Drummond is starting to do similar. What's clear is what they won't accept. And again, this goes back to the idea that this is not an exercise that is conducted within a pristine certification directory, and you're going to use a staged test tool. So the ONC test methods or the ed testing tool are referenced as an endpoint that wouldn't be acceptable for real world testing. Although useful, and my experience has certainly dictated this, connectathon type events, in those environments, you're pretty much locked down and you are trading, even though it might be synthetic data. Those organizations are typically test environments only and quite locked down. So any past credit for a connectathon would not count towards real world testing. So just to be clear. I do want to highlight here, it's emerging technology here. We're finishing this up for ONC, but we have developed a healthcare interoperability hub used largely to support surveillance-based activities to determine that connectivity is actually in working order and exists. It does have direct messaging and CCDA and Fire server and API client test tools built into it, in addition to some other helpful information in terms of surveillance and in terms of real-world interoperability. So this is something that is moving live to our customer base over the next quarter. We'll look forward to that. And again, we're positioning this also as part of our daily requirements for when surveillance does occur. This is a measurement tool that may have some benefit and applicability to real-world testing. So more on that separate topic. If you're interested, myself, John Velukovich, can be contacted about this particular Drummond offering. So let's think a little bit about what we know about the format, okay? So again, right from the final rule at a high level, what belongs in your test plan. And again, this testing, the method or the methodologies that you're to be used must demonstrate real-world testing and interoperability. There is verbiage in there that, on scenario, on use case focused testing. And again, what does require clarification? Well, I'll be frank on this, and a topic of conversation that we're having, us and other ONC ACBs, is the relationship and sort of the demarcation line between use cases and available functionality. You're used to completing all the test cases that are required for certification. And how does those certification test cases apply to real-world use case and scenario testing. I believe there is a difference in there. Again, we're engaged with O&C on this, just to clarify some questions that we had out of the gate upon review of real-world testing. But the care and practice settings, again, conformance to what is your scope of the certification criteria, and an explanation for the health IT developer's choice of care setting to test. Look at that final item there, which we'll touch on throughout, justification of the overall approach. The timeline, and I have this spelled out in the next slide or two, is the timeline and plans for if you are going to be in between submitting your real-world testing plan at the end of this year, and then perhaps you decide to migrate to FHIR V4 before or during or after that. How do I justify when I might want to perform my real-world testing and gather the results? That's why there is the large time frame between submission of a plan and actually the collection of results. The description of the actual outcomes, what use case scenarios or results you would expect to demonstrate that proves in a real-world test transitions of care, for instance, or view, download, and transmit. There's at least one measurement/metric that has to be related to the real-world testing for each certification in scope, often aligns with a chapel line item. And then finally, this is where corporate office is going to sign on the dotted line. This is the justification for your approach to real-world testing. You as an acute, as an integrated, as an ambulatory, as a portal vendor, say this test plan accounts for my certified criteria as it applies to real-world testing, and that my singular test plan accounts for my ambulatory software that might be used in a large physician practice that also may have a laboratory system or an ER type system in portion of that. So drawing dotted lines to a place of service would be part of that justification of the overall approach. And again, that justification statement, that's something you know best. You'll be able to articulate to your existing and potential customer base now that they have a whole other avenue to compare your product to others when they go shopping and leverage the chapel as part of that initiative. We do look at this section here in some conversations with O&C. It's important to note that the format is emerging. O&C has mentioned that there's going to be templates that they are going to provide for O&C ACBs. We will have an opportunity to vet these, work through these, to ensure that for our customer base and frankly for us, the ability to collect and review real-world testing plans, the ability to collect and to review testing results, and publish both a test plan and test results reports to the chapel are something that's easily understood. We may leverage, you're used to from the Drummond perspective, the NIST test cases morphed into Drummond Proctor sheets. Expect something like that. We certainly have our own ideas about how to collect a lot of this information, but we, like you, do expect some clarity around the exact format and for particular real-world testing environments, how many test cases I actually have to go to and whether test cases are replaced by use case, and that justification portion that a vendor makes may account for that. So these are things, frankly, again, are emerging. We expect more clarity over the next couple of weeks, certainly before the final rule becomes essentially final by June 30th. So know that there's more information coming on that. So let's talk a little bit about the timelines in terms of what to expect. When do I need to start to get ready for preparing for real-world testing? So again, from the final rule, you'll notice compliance date and then what the condition is. So originally within the final rule, and this still stands, is as of September 1 of this year, it is the opening day of real-world test plan submission. You can, as early as September 1 of this year, submit your real-world testing plan. By then, we'll have a format. By then, you'll know, what do I mean by justification? What do I mean by settings of care? So it's good to know that the compliance date isn't any earlier from September, but you do technically have up to, if you look at the final rule, the original date was December 15th, 2020. Okay, that's the final day to publish real-world testing plans to the chapel. That's to ensure that we have collected those, reviewed those, provided any feedback, and put those over to the chapel. We do have in gray there, we're going to recommend and ensure our customers try and finish these well before that particular deadline. Because again, if we get everybody in on December 14th, things are just frankly going to make things a lot more difficult for everybody. So expect that we're targeting November 2020 for real world testing plans, with the assumption that we get all the clarity that we need well before September 1. So again, there's that asterisk in there because of the enforcement discretion that does apply 3 months after the compliance timeframe. That's all in light of COVID-19. ONC has decided to exercise its discretion in enforcing these new requirements. So again, we're going to stick to the deadlines where at all possible. If there's any extenuating circumstances that will put you past that, we'll advise our customers to start to get in touch with us as you get closer to that. So the final date for publishing real world testing plans, you can see there, is the end of this year. And then you'll notice that originally you had technically over a year to complete your testing. Again, should you decide to update your fire protocol and you want to just do real world testing and draw the line there, you have the opportunity, you have some time frames to work with those test or staging directory or directories plural to start to gather your real world testing results. So the final day to publish real world testing results to the chapel, it's gone through review, companies have signed off on it. All of the activities that go along with that process was technically March 15th. Again, there is an enforcement discretion date allowing for 3 months after March 15th, should you need it. But again, you expect that we would want to put a date out there ahead of that, about a month prior, to ensure that we have the opportunity to do our due diligence and ensure that we're not reviewing many of these at the last moment. It goes without saying, but we figured we would put that in there anyway. So those are your timelines. So your homework assignment, does start now. You have to start thinking about this and start designing test plans if you have different platforms, different versions, and a number of different chapel listings, especially for larger comprehensive EHRs. Your homework is probably already starting. So let's talk a little bit about the services that go along and may complement this. Right now, we're committed to steering you, our customers, through this new requirement and to ultimately ensure certification is maintained and that your customers are fully aware of your product's compliance with the 21st Century Cures Act final rule. That goes without saying, and so we are developing and looking at there's unique service offerings to accommodate your different needs, whether you're wanting to conduct real world testing on your own and merely just submit test plans. We review them, stamp them, put them up to the chapel. You do your own test results. You can pretty much be self-reliant doing that. That opportunity is there. So for those customers that may self-prepare and submit a few questions of Drummond along the line as expected, that pathway is there. And again, the opportunity may be to leverage some additional Drummond services with that. Should you want to use the hub? And again, we will formalize this through an announcement and additional publications on Drummond real-world testing programs over the next quarter or so as we wait for the final rule to be published. But you may leverage an opportunity to say, yeah, I'd like to sign up and use the Drummond hub to help me through my real-world testing. That's one opportunity. The other opportunity is, I'll just put this out there, and I'm going to highlight the fact that Drummond, as you may know, is we do matrix interoperability testing and have done that for a long period of time. It's what the company was originally founded on. So we look at models for our AS2 B2B business testing matrix, and would something like that apply to putting different customers together in a testing matrix to allow them to accomplish real world testing. As we look at probably 4 of the 6 criteria, you could probably do that. And we also have had a couple of requests, customers saying that, how much could we actually take on? Could you offer something more of a full service? Could you provide to us, based on what you know about our certification and all of our products, a real world testing plan? You queue up the trading partners for us. We'll work with you, obviously, to get access to a customer system or systems. But again, the coordination and the endpoints are all worked out, probably some test data, report formats, and then there's the additional assurances of having compliance services and assurance. Look at this and stamp this and make this official and put that forward to the chapel. So different levels there. I will say that full service testing offering and some of the other resources that we provide, it's very clear in the final rule, and we're aware of this here and are working through with our legal teams that there is a delineation between our role as an ONC ACB and surveillance versus our role as an ONC ACB to support certification and real-world testing environments. Okay, so again, more on this. I envision to finalize all of this. We're in discussions now. A couple of customers have offered some suggestions that we look to early Q3, right after the final rule becomes official, to officially provide more detailed information for our customers on, okay, real-world testing. And everything opens up for business as early as September 1, based on the final rule. Okay. So continuing on here, what I do want to do is say this is going to conclude the main portion of real-world testing. We do have some opportunity for Q&A. We'll get to that in a moment. But what I do want to do is just park the thought here that, again, reminder for both previously recorded webinars, including this one and forward, that you can see below, there are some additional webinars that break down the test criteria in a lot of detail and go over certification as a whole for the next couple of weeks out on Tuesday. Again, there's from the same area. This will be published. Obviously, the finals rule in the Cures Act, you can access that. And we look at, there's clarifications to come on the test plan and the result format. We expect that soon from our ongoing discussions with ONC. I can tell you that we, as an ONC ACB and the others, we are on weekly webinars and conference calls and training sessions with ONC since the middle of March all the way through May on Wednesday. So real world testing is one of the things we're getting some more clarification on. So know that all of us are getting some additional training on that. We felt this was timely to get some of this information out right now. And again, we are staging real world testing program with a couple of iterations for our customers depending on what you need. As you get questions as they relate to certification as a whole, including real world testing, encourage that as customers, use your customer portal, or you certainly can use the certification@drummondgroup.com mailbox, which is monitored. And again, just a reminder, next week and then subsequent weeks at this time, same channel, we'll be offering some additional Drummond webinars. All right. With that, I can say that completes the real-world testing overview. Somewhat detailed where possible. We're looking for clarifications. I'll now engage Karen and Melissa to see if we can work through some of the questions that we have. And again, I'll reserve the right to say that if we're expecting ONC clarification and how that aligns, we'll put that out there. So let me pivot over to Karen and Melissa, and we'll start to see if we can get through some of the questions.
Okay, thank you, John. Let's start. So question number 1, John. If our customers are actively using the certified modules, can real-world testing simply be reporting on the activity that is occurring in production? An example is using direct messaging.
It appears as though just reporting or observing may be part of a result obtainment, but that's why they do list trading partners and they do list a metric. We look at, and again, this is open for interpretation. We do look at observation criteria might well apply to public health testing, also the CQMs. But direct messaging and perhaps looking at what I used to know as like an interface queue or an interface manager, just looking to say that the transaction went out and we've exchanged X amount of direct messages on a given day. That exchange has to be proven more than just an observation from one side. That's why it's our belief and why the interpretation from the final rule is they do list trading partners. So again, just take direct messaging, whether it's the interoperability hub, whether it's another client to client or direct trust, there's going to need proof that a message from your real world and testing environment went to and was received by another organization. That appears to be the interpretation at current.
Great, thank you, John. Okay, next question. When identifying customers, is it necessary to select customers that have or are participating in an appropriate Medicare or Medicaid program? Or is it simply using the version of a software?
Actually, a really good question. I think what that basically would probably work its way into is proof that in fact, in your justification approach for your plan, that you are actually using a real world testing client directory staging organization versus just using I'll call it a test or certification directory. The final rule, to my knowledge, does not equate the two and name Medicare participant or Medicaid, but it sure would help justify your approach that you in fact conducted real world testing in an environment that mirrors a real world testing solution and compliance directory, I would say.
Great, thank you, John. Okay. Next question. Can you please clarify your actual due dates for developers to submit their first round of test plans and results to Drummond?
Sure. And again, what I'll do actually is I can go back a number of slides here. So when we look at the time frame slide, okay. The dates here, what's highlighted in bold is from the final rule. Okay, that essentially this is the final rule says these are the dates in which you need to adhere to. So for December 15th is when the final day real world testing plans are supposed to be posted to the chapel by us, your ONC ACB. Now again, there's that enforcement discretion. So it basically says that if you don't get your final chapel update by December 15th, which means it's gone through the ONC ACB and we were able to publish it by then. If you don't make that deadline, ONC will not penalize you. ONC, we won't have to issue a cap, for instance. You do have 3 months after that to finish up your real world testing plans, for instance. You have until the end of June of 2022, technically, if you don't have your results published by March 15th. So that's the way it reads right now. That's what they mean by an enforcement discretion. That enforcement discretion is levied by ONC. So from a Drummond ONC ACB, it would behoove us, we'll give you reminders, we'll stage these plans and updates to your customer portal and work with you much like we did for self-attestation and quarterly reports to ensure that you're submitting those on time. You miss those deadlines, there is ONC rules that govern what we have to do. Normally, if you submitted on December 16th, there would be an ONC rule to say that you're not in compliance with certification criteria. Because of COVID-19, you have 3 additional months to submit that. That is the best way I can explain that. Use your discretion. That's what the enforcement discretion reminder is. There is actually a blog on this as of Tuesday of last week on ONC's website that gets into the detail behind other enforcement discretions that have to do with ONC dates in terms of the 21st century final rule. Obviously, these ones apply for real world testing.
Thanks, John. Actually, there was a message in the chat that your slide did not advance. So we actually didn't see the date slide. Maybe if you can find it and see if.
I will roger that. I will go back to, let's see. How about now?
There we go.
Great. Apologies.
Thanks, John.
Yep.
Okay, we'll go on to the next question. Are plans and results required every year? For example, is a plan due in 2021 the same year results are being gathered?
That's a good question. And the answer is yes. Yearly test plans and results are required. So for instance, let's just go by the final rule. The first test plan is due by December 2020. Final rule. You have an opportunity to submit past that and you won't be penalized for 3 months, right? But by the rule, the second test plan is due December 2021. So could I still be doing my test results and plans? I have a full year plus to do test results. That's correct. But there is the requirement for, on an annual basis, the submission of test plans and test results. So again, using that example, first test plan, December 2020. Second test plan, December 21. And the spirit of that is to ensure that on a yearly basis, there's proof that your product is working as it's supposed to and as certified. And it gives you some room that, again, for certification criteria and maintenance of certification, should you update, again, I'll just pick on the API criteria and migrate to Fire 4 at some point next year, for instance, that's part of your new test plan. So good question.
Okay, thank you, John.
Mm-hmm.
The next question. The presentation mentioned a 1-to-1-to-1 ratio of chapel to test plan and test results document, but it sounded like the test plan could overlap some chapel listings, but the result would have to have a separate entry. Is that correct?
That appears right. Let me just make sure, number one, I'll just back up to that screen. Okay. And they do go on in the final rule about that. And it reads really much like that, the real world testing plan and results report must address, each of your products that is listed on the chapel. Okay. So again, you may have multiple health IT products that may be part of the same module certified to one or more criteria within the real world testing spread. Okay. You have some opportunity to, again, goes to the justification, design a real world testing plan that could test a combination of products that include the certified criteria. The thing is that the testing plans and results are what's called, and they use a word called traceable, that's it, to specific certified health IT modules. And each criteria to which a health IT is certified has to be addressed in the settings for which they're marketed. So again, there is, the idea here is that when I say 1-to-1 ratio, when you look at your chapel listings to day and time, is it accounted for in a test plan? Right. Is it also accounted for in a test result? A test plan could account for a comprehensive EHR that has to do all of them. And that comprehensive EHR test plan has to do, let's just say, the transitions of care interfaces, CCD exchange, for instance. You may also sell that as an individual item that someone may use another combination of EHR software, but they buy your interfaces separately. So because you tested it comprehensively, and you can justify that that was the version that was tested in your comprehensive test plan, then you have an opportunity to filter that test result down. It's sort of a parent-child inheritance. That is alluded to in part of the flexibility designed in the final rule. So I hope that clarifies that, for your chapel listings, inventory them all, account for them in a test plan, and then in terms of results, determine that if I sort of cut out or I've pinched off additional healthcare IT technology that someone may want to buy a la carte, but I tested it as part of a comprehensive, it appears as that works quite well within a real world testing plan. The key will be that And for those of you that are large or have multiple versions and multiple chapel offerings, when you start getting into multiple product versions and they work differently, the reason you probably have them listed differently on the chapel is going to be the reason that you may have to test them differently or account for them in a test plan. Best way we can look at that at current. Good question. Thanks, Karen.
Okay, next question. If we have two versions on the same product listed on the chapel, do we need to submit one test plan or two test plans, as well as the results?
Two versions of the same product listed twice on the chapel. Okay. Test plan has to account for both. If the versions are significantly different, required significantly separate certifications, then my assumption is that they're going to require two different test results. It also too is, again, what's swirling around this whole concept team is the idea that you have different chapel listings for a reason, to distinguish between them. And part of it is, the cart method. I may go a la carte. If whatever is listed separately is the same version as something that you can test in a comprehensive EHR, then as long as both are accounted for in a test plan and the result is the same, you can test it the same, then that accounts for a one-to-one. But when you start talking different versions, a customer will license version 1, and if they have if they don't, and other customers license version 2, then in my mind, that's two different test results, but could be part of an overall comprehensive test plan. I will stipulate also too is we do await O&C guidance on what a template is supposed to look like. One of the questions we have asked is exactly that. Knowing our customers like we do and others as well, the fact of the matter remains is that in terms of use cases and versions, what has to be filled out on these templates. It is pretty clear that, again, everything on the chapel has to be in a test plan, probably plural, and you need to justify that one result of a transition of care interface, for instance, in a comprehensive EHR, well, that's the same result as that same version of that transition of care interface that someone may buy a la carte. When you start talking different versions, my recommendation would be to ensure there's separate test results.
Okay, thank you, John. Next question. If we use a third party, for an example, a patient portal, and the third party has certified against the criteria, do we still have to include those criteria in our product's test plan?
I would say the answer to that is yes. Now, whether it's by association, and for instance, there's pathways in the chapel to do that, but within chapel filings, if memory serves me correct from my EHR days, where we did involve subsequent technology, it was very clear in our chapel listing what that subsequent technology was and what its certification status was. So although that third party may be responsible and probably should be responsible for conducting test results, they have an onus to those companies that license their products to ensure that their test results can be filtered or sort of inherited would be one way I would say that. So that would be yes.
Great, thank you, John.
Yep.
Next question. So John, can you go back regarding the test results? Are they needed within each type of clinical setting a product is marketed?
Good question. Yeah, so we'll go back to that a little bit. And I'm going to use the word again from the final rule. It's traceable. You know, test plans, test results. You can trace them to, you know, certified health IT, and to which they've obviously been certified. They must address the types of setting for which the products are marketed. So they are. It basically, in terms of, you know, the report. The test plan, if I have it used in more than one setting, I may be able to have a test plan that encompasses part of a real world testing criteria. It works the same in this POS as that POS. And I'm able to basically go backwards and justify through the report that the results obtained would be exactly the same, whether I deployed it in an ambulatory setting of care or I employed it in a larger ambulatory setting care that happened to have an emergency department module. They were using transitions of care there separately from using transitions of care in the ambulatory side. So that's the best way at current we're aware of how that goes. I would say, and we still have a few minutes, you know, I would err on the side of caution. So in terms of, you know, my test plan, all of the documentation my test plan accounts for, wherever I've deployed that module. The test results, if I can justify and I can clearly explain in the justification portion of the report and the results that this result applies to settings of care A, B, and C, then that's probably going to be satisfactory. Frankly, one of the other questions that we have for O&C is in terms of, for those folks that are just going to go the self-prepare and submit route for both reports and test results. The idea there is that how deep into the details do we, as an O&C ACB, have to delve? Obviously, at the core of this is maintenance of certification. So the plan, yep, this looks like this would prove that the product works correctly in the field. This is a good plan. There is some leeway for judgment and conversation with each one of your customers on that. And then the test plan is, and the result portion, again, you know your customers best. We know how to certify software quite well, but you are you have ownership over where your product is marketed, and could explain at the end of the day to a potential customer that may want to use your product in a hybrid environment, for lack of a better term, that test plan does account for that environment to which a customer may want to deploy your product. You do have the final say. So that's the way I'll put that.
Great, thank you, John.
We got lots of questions queuing up there. Now, Karen, you're queuing through the ones that we know we have some semblance of an answer for based on our research. And for those of you that there's a lot of questions out there, do appreciate that. We, like we did with the other webinar, will curate all these questions and provide some additional responses and follow-ups as well as the recording. But I know she's going through ones that we think we might be able to answer while I'm at the plate here. So thank you for that, Karen.
You are welcome. Okay, I think we have time for just a couple more.
Okay.
John, this one came through the chat, not the Q&A. And I think it pertains to the Drummond service offering.
Sure.
Does providing this service present a conflict of interest with Drummond's accrediting function? What are you doing to keep those separate and not privilege those who don't use your real-world testing service?
Right. No, that's actually a really good point. So yeah, it's very clear. We've already reviewed in here and started the process through both our ANSI accreditation and with our legal team that number one is pretty much what we consider the standard around that. If we're fortunate enough to have you as a customer from the Drummond perspective, then it's clear within the final rule. And ONC ACB has to review your test plan and publish it to the chapel. We have to review your test results. Everything aligns with your chapel listings and everything that has gone through certification, and publish that to the chapel. So that's part one. After that, as we look at some of the opportunities to offer additional support and services on top of that, there's that clear delineation between, rules for our role of using software and tools for surveillance versus processing certification versus processing quarterly attestations and things like that. So we are aware that there is a separation of duties. We are aware that, again, we're grateful, but we are one of 4 ONC ACBs out there that have to do this for the market as it is right now. And we recognize that, in this environment, in this day and age, a lot of responsibilities sitting on our shoulders of our customers, both financial to their customers as well. So we are aware of that. Like I said, there's ANSI rules and regulations around that we adhere to through our yearly accreditation. And we've obviously stepped forward with our legal team to ensure that as we have the separate test lab and certification authorities here, the real world testing falls within appropriate lines for that, for those that just need us to be their pathway to ONC Chapel publication, the guidance and customer support that you come to expect from Drummond, things such as templates and things such as, templates plus, I would call it, the Proctor sheets that are proprietary to Drummond, and that work that we did from NIST to getting you through the test cycles. Expect an investment on Drummond to getting you through, here's this essentially open-ending real-world testing requirement. And for those of you that there's offerings within that that come with the standard customer offering to support you through real-world testing. So it's emerging. Comments welcome on that, as well as we look at perhaps, do we build up a mini testing matrix for customers that we know that might be interested in. And we've been fortunate to have proactive interest prior to this webinar that, we're in, we want to do that. So we welcome additional comments and feedback on that. So it is emerging, and I hope that everybody in attendance that, and based on our fortune to have customers for as long as we've had them through stage 1, 2, and 3 and forward, you could expect the same sort of service and compliance from Drummond to get you through this. So I think we probably have time for one more, Karen, and then you, like me and a few others at Drummond, we're off to an ONC call in 2 minutes. So. Yes,
and let me just repeat that all questions in the Q&A will get answered if we have not gotten to them live. Last question, is it acceptable to have a less than 100% success rate during testing?
That's actually a really good question. They don't list percentages, 100, 75%, 85%, in terms of getting test results. They don't actually list that you have to do 10 direct messages, for instance. So you better get 10 out of 10. So there is at current no clarity around that. I think that is probably part of the reason that you have the length of time that you do to perform your real world testing, to ensure that the real world testing results and reports that you are responsible for demonstrates compliance and that the product works, as opposed to perhaps, you observe an interface queue over the course of 2 days. Well, network interruptions happen. It's not a result of poorly designed interface software, I might say. Sometimes connectivity goes down. So should you be penalized for that? I don't believe that's the spirit of what they're looking for here. It's my best way to answer that at current. So let me pause there and say, again, we had about 300 attendees. Really appreciate that. Appreciate you as a Drummond customer. You do know how, per resources or reminders, to do get in touch with us. Certification at drummondgroup.com. Apologies. And do look for updates, this webinar, Q&A to be answered, And then as soon as we receive more clarification from ONC on these templates, for instance, that will support your plans and submissions, we'll be sure to let our customer base know about that. So I wish you health and good luck forward. Regards.